It's a scary thought, but one that health officials are thinking about tonight. Earlier in the show, we told you about the alarming situation unfolding in Mexico and the U.S. Alarming in part because we don't know where this is going. The virus could sputter out. It could also explode, a scenario that health officials have been watching and waiting for quite a while. If you want to know just how serious an outbreak could get, you won't want to miss this. Here's Kelly Crow.
Could swine flu come to Canada? That's what these scientists are watching for. Here at the Ontario Public Health Lab, they're receiving samples from across the province. Specimens taken from anyone who's been in intensive care in Ontario over the last few weeks, suffering from a respiratory illness. If they find something that looks like the swine flu virus, they'll send it off to the National Microbiology Lab for confirmation. And like everyone who works with flu viruses right now, they've had a very long day.
It's quite busy. We are actively coordinating our activities, both here in the laboratory and with other organisations. We are actively preparing to deal with potentially increased numbers of testing.
Long-time pandemic watcher Dr. Michael Osterholm has also had a long day.
I think it's fair to say that those of us who have been anticipating the next influenza pandemic have worried that one day we would not be able to go to sleep at night because we would be thinking that maybe this is it. And I can tell you there were a lot of people that didn't sleep last night.
As director for the Center for Infectious Disease Research at the University of Minnesota, Dr. Osterholm has been involved in the surveillance for the next pandemic for years. Now he's afraid they might be seeing the very thing he's been watching for, an animal virus that can infect humans, something for which humans have no immunity.
The question is not whether it will continue to transmit for a few days or a few weeks, but will it transmit around the world? Will it continue to cause lots of illnesses, and will many of those illnesses be very severe? If that all happens, then we are literally sitting at the doorstep of the next pandemic.
Canadian scientists at the National Microbiology Lab were the first to get a look at the Mexican strain of the virus. What they saw surprised them. It wasn't quite human flu, not quite swine flu, but a composite virus with genetic fragments from the North American swine, the Eurasian swine, North American birds, and humans. And once they matched it with the strain that has infected Americans in Texas and California, they knew this virus had acquired the nasty ability to travel from one human to another across a wide area and cause a serious disease, making it a candidate for the next pandemic.
There's substantial widespread person-to-person transmission, which in the past has been the barrier for an influenza strain becoming the next pandemic strain. And until we really understand what this virus will do, which could take us weeks, we won't know if we are at the beginning of another pandemic or if in fact we're still waiting for the pandemic strain to arrive.
It's also bringing back alarming memories of the Spanish flu of 1918, the deadliest pandemic of the last century. That virus targeted young and otherwise healthy adults.
There is a concern that many of the deaths that have been reported as of now have occurred in otherwise previously healthy people in their late teens to their early to late 20s. That's not a good sign.
The annual flu vaccine will not protect against this new swine flu. Scientists have already started preliminary work on a new vaccine, but it's too early yet to know if they need to rush it into production.
If in fact we do have an emerging pandemic with this strain of swine influenza, we're pretty much screwed when it comes to the vaccine issue. The current vaccine will not protect against this virus. Worldwide capacity to make vaccine is still limited largely to about 400 to 500 million doses per year, and it would take us at least 3 to 4 months before most of the vaccine would become available.
In the World Health Organization's war room, officials are struggling to decide if it's time to raise the pandemic alert, which has been fixed at level 3 for years.
Is this going to be one that it will only be a problem in Central America for potentially weeks to months and then become the next pandemic? Or in fact, are we there now, and over the next weeks, we're going to see, even in a first wave, cases showing up around the world with very large numbers of people not only becoming ill, but potentially dying. All of these possibilities are yet before us, and we just don't have a clue which one it's going to be.
Pandemics are like earthquakes. It's just a matter of time before another one happens, and flu watchers believe the world is overdue. So, how worried should we be? Well, the situation is developing quickly, and the acting director for the Centers of Disease Control isn't doing much to downplay the story. In fact, he said it's important that people pay attention to what's going on here. Kelly Crow, CBC News, Toronto.